This spray is used to temporarily relieve congestion in the nose caused by conditions like the common cold, sinusitis, hay fever, and allergies. It works by narrowing the blood vessels in the nose, which helps reduce swelling and congestion. It is important to follow the recommended dosage and timing for best results. To use Anefrin spray, non-aerosol, follow the directions on the product package or as directed by your doctor. Gently blow your nose before using the spray. Close one nostril and place the spray tip into the other nostril while keeping your head upright. Spray the medication into the nostril as you breathe in through your nose, and then sniff hard a few times. Repeat for the other nostril if needed. Avoid spraying the medication into your eyes or onto the middle of the inside of your nose. After each use, rinse the spray tip with hot water or wipe with a clean tissue and replace the cap. This medication provides temporary relief, so do not use it more often, use more sprays, or use it longer than directed. Using it for more than 3 days may cause rebound congestion. If your condition gets worse or lasts after 3 days, consult your doctor. When using Anefrin spray, non-aerosol, you may experience temporary burning, stinging, dryness in the nose, runny nose, and sneezing. If any of these effects persist or worsen, it is important to contact your doctor or pharmacist immediately. If your doctor has prescribed this medication, it is because they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. However, it is important to notify your doctor immediately if you experience any serious side effects, such as changes in heartbeat, dizziness, nausea, headache, changes in mood, trouble sleeping, trembling, unusual sweating, or unusual weakness. Although rare, a serious allergic reaction to this drug may occur. Seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so it is important to communicate with your doctor or pharmacist if you experience any other effects. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before using Anefrin spray, non-aerosol, it's important to talk to your doctor or pharmacist if you have any allergies to this product or other sympathomimetics. This medication may contain inactive ingredients that could cause allergic reactions or other problems. If you have heart or blood vessel disease, overactive thyroid, diabetes, high blood pressure, or difficulty urinating due to an enlarged prostate, consult your doctor or pharmacist before using this product. Before any surgery, make sure to inform your doctor or dentist about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. Children may be more sensitive to the side effects of this drug, so it's important to check the product package or consult with your doctor or pharmacist before using this nasal spray for children. During pregnancy, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. And if you are breastfeeding, consult your doctor before using this medication. When using Anefrin spray, non-aerosol, it's important to be aware of potential drug interactions. Taking MAO inhibitors with this medication can cause a serious, possibly fatal, drug interaction. It's crucial to avoid taking MAO inhibitors, such as isocarboxazid, linezolid, metaxalone, and others, during treatment with Anefrin spray. It's also important to consult your doctor about when to start or stop taking this medication. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist to ensure your safety. Remember, never start, stop, or change the dosage of any medicines without your doctor's approval. If you or someone you know has overdosed on Anefrin spray, non-aerosol, and is experiencing severe symptoms like passing out or difficulty breathing, it's crucial to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can call 1-800-222-1222 to reach your local poison control center. Canadian residents can contact their provincial poison control center. Symptoms of overdose may include drowsiness, slow heartbeat, dizziness, and fainting. It's important to be aware of these potential symptoms and seek help if needed. Always remember to use this medication as directed by your healthcare provider and never exceed the recommended dosage. It's important to remember not to share your Anefrin spray, non-aerosol with anyone else, as using the same container as someone else could spread infection. There are many different nasal decongestants on the market, some of which don't require a prescription. If you're unsure which product is best for you, it's a good idea to speak with your doctor or pharmacist for personalized advice. And remember, always use medication as directed. Anefrin spray, non-aerosol is used to relieve nasal congestion due to allergies, hay fever, and the common cold. It works by narrowing the blood vessels in the nasal passages, which reduces swelling and congestion. This medication is for use in the nose as directed, usually 2 or 3 sprays in each nostril every 4 hours. It is important to use this medication only as directed. Do not use more of it or use it more often than recommended on the label, unless otherwise directed by your doctor. If this medication is used for a long time, it may not work as well. Talk to your doctor if this medication stops working well. Make sure to check the storage information on the package and keep Anefrin spray, non-aerosol away from heat and light. Always store medications out of reach of children and pets. When you no longer need the product or it has expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. Avoid flushing medications down the toilet or pouring them into a drain, unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.